Why does portal hypertension cause splenomegaly? Well, this will be a lot easier for a lot of you guys, but let's keep it very clean and simple. Let me first explain very high yield anatomy points. So let's start. So I will ask which vein leaves the liver? Yeah, it's hepatic vein. And which vein enters the liver? Yeah, it's portal vein. And which two veins merge to form the portal? Yeah, splenic vein and superior mesenteric vein. When a patient has cirrhosis, that might be due to alcohol or hepatitis B or C or hereditary hemochromatosis, but it does not matter what is the cause. Once the patient has cirrhosis, so it leads to congestion, so blood cannot enter the liver as easily as it is supposed to. So it will back up into the portal vein, and that could back all the way up to the spleen, leading to splenomegaly and congestion. A USMLE can ask similarly that there can be a scenario where the patient has a heart failure and he has right sided heart involvement, and blood can back all the way up to liver and then to spleen, causing hepatosplenomegaly. It's in short, it's just knowing the basic anatomic details. That's it. There's nothing rocket science about all this. It's just knowing that where things just back up to the basic anatomic details. And I just want you to memorize that portal vein forms when two veins, splenic vein and superior mesenteric vein, merge together. But USMLE takes a step further. So you might see a scenario about a patient on USMLE where patient has cirrhosis and he has cancer, and then there's a lengthy scenario that he has severe abdominal pain, and surgeon goes in and he sees a mottled violaceous appearance of the bowel, and there are different diagnoses, and they're asking about the final diagnosis of the patient, and you're clueless that what's happening, what's going on inside the patient. So so the it, it's quite easy. If you look closely, actually, if the patient has cancer, it means there will be hypercoagulable state as tissue factors get liberated by cancers, especially adenocarcinoma, but it does not matter what type of cancer. So there will be hypercoagulable state, and then secondary to cirrhosis, obviously there would be stasis, and you can recall Wickhouse for thrombosis. That's endothelial damage, slash injury, endothelial injury, and hypercoagulable state and stasis. So here you got in this patient two out of three of these very high yield factors, very important factors. So there might be some thrombosis. So and you find mesenteric bowel thrombosis, mesenteric venous thrombosis. So that's the answer. Similarly, you can get splenic thrombosis, splenic vein thrombosis as well due to stasis.